So I have an impossible task that you've assigned to me to give an overview of COVID-19, its impact on health and society worldwide. I'll start by a summary of the numbers up to today. So worldwide, 22.5 million cases and rapidly increasing, with 788,000 deaths. An important number to note is that 85% of the countries worldwide have reported cases of COVID-19. I've listed for you on your screen the countries that haven't reported COVID cases to date. For the most part, these are small countries, but there's some, such as North Korea, where we don't know if in fact there are any cases. The next slide shows a map of the world, which is familiar to all of you, and gives the number of cases that have been reported. And here I use the week of August 2nd to August the 8th, and the color density indicates, in fact, the number of cases in the last 7 days. So very familiar to you, and I won't spend time on it. This is showing the data in another way to let you know, again, familiar data, the countries that are most affected in the world. And here are the 10 most: US, Brazil, India, Mexico, Colombia, South Africa, Peru, Iran, Argentina, and Russia. My next slide, which doesn't seem to want to come, indicates where Canada fits in relationship to the daily number of new cases, which are population adjusted. US and Brazil are at the top, and you can see Canada is somewhere in the middle. But what we've learned very much from COVID-19, looking at a country or even a small geographic region, doesn't really give you an idea of the full extent of the epidemiology of COVID-19. So here's a map of Canada with 10 provinces and 3 territories. Again, a density map showing the number of cases per 100,000 population. And you can see quite a variation. So Quebec and Ontario, which are the most populous provinces in our country, had also the highest rates per 100,000 population. The Atlantic provinces where I live had very low rates. Number of cumulative cases are shown on this slide, but all of this is misleading. On this one looks in greater detail at what's happening in each province, and then within a province, getting down to the city level, and even within the cities, down to neighborhood levels. So this gives the effective reproduction number of SARS-CoV-2 for the 10 provinces in Canada. And what it shows is that early on in the epidemic in Canada, or the pandemic, the R was high, and as measures were put into effect, R was reduced. But you can see in various provinces, it had upward trends further on in the course of the evolution of this pandemic, depending on various epidemiological events. So, for example, in Alberta, outbreaks in meatpacking plants account for the upswing here. Now, to summarize what's happened to the effects of COVID-19 on society, I have this slide, and I've divided the effects into 3 broad categories: personal ones, community ones, and then those for greater society. And it's impossible in 20 minutes to do more than just enumerate what's happened. These are all familiar to you, but there is a great difference between the personal effects and looking at the world epidemiologically. So illness and death, unemployment, when they strike you as an individual or a member of your family, the effects are much, much greater. Stress, aggravation of pre-existing mental health issues and precipitation of new ones, increase in intimate partner violence, increase in consumption of alcohol and illicit drugs, and also an increase in fatal overdoses. At the community level, the loss of freedom of association, what that's doing to the community as well as the person's loss of cohesiveness. Fear of contagion has increased, so much so that it's brought out some of the worst behaviors in us as individuals and also how we act as communities. So our neighbors are suspect they may be spreading the disease. There's been, in some areas, loss of trust in science and medicine, especially in public health, and entire governments. Policing has been also suspect, and that varies from country to country. If we step back and look at society as a whole, as governments for their countries have tried to cope with the unprecedented effects of COVID-19 by increasing spending, we have mounting debt and deficits. We have closed borders not only from one country to another, but also even within a country, from state to state, there's been closures. So that's having quite an effect on us as a society. And indeed, the entire fabric of civil society has been threatened in some countries more than others. To cite just one paper for you, this is a report from the Morbidity Mortality weekly report in the US, which appeared just a little while ago, a survey of the effect of mental health, substance use, and suicidal ideation during the COVID-19 pandemic in the US from June 24th onwards. And the survey was sent to 9,896 persons, roughly half or a little more than half completed the survey. 41% reported at least one adverse health effect or behavioral condition. Anxiety symptoms were experienced by a quarter of the entire population versus about 8% for the quarter of 2019, where a comparison could be made. For depression, almost the same, 24% versus 6.5%. And suicidal ideation in the past 30 days was more than twice as high as it was in 2018. So pronounced effects on mental health. This is just one slide showing some of the effects on the global economy. What I wanted to do in the next few minutes was to indicate how the Royal Society of Canada has responded to COVID-19. So in April 2020, the board of the Royal Society and our president, McNeil, who's with us today, decided that the members of the Royal Society of Canada should do what they could to help Canada emerge from COVID-19 as a better society than it was going into it. A very much an aspirational goal. To accomplish that, a task force was established, and two broad approaches were taken. The first was to have evidence-based short pieces on particularly germane topics that were to inform the public and decision makers. And with those, we have had a robust communication strategy to get them in front of members of the public by having a partnership with one of with the major English language newspaper in Canada, the Globe and Mail, and also with 2 French newspapers in Quebec. And they examine these pieces, and some of them they publish and some they don't, but they all go on our website. Members of the task force have been charged with more in-depth examination of specific issues with a goal to producing policy documents. And the major effect that we want to achieve with these policy documents is to have them in front of decision makers so it will help them make better decisions as they're trying to deal with the effects of COVID-19 on Canada. This is a listing of the working groups that we have examining the various issues that we thought deserved in-depth examination and were worthy of policy documents. So these could vary from country to country. The first one that we wanted to look at was long-term care. And in Canada, the COVID-19 pandemic has exposed many weaknesses in our society, but one of the most important weaknesses is exposed is how we treat and how we look after elderly people in our community in Canada. Nursing homes or long-term care institutions was felt for many years to be one of the best ways of doing that. However, with COVID-19, it suddenly showed that in large institutions with the communal bathrooms, or not, rephrase that, not in individual bathrooms for every resident, some that share them, usually 2 or a few more, and then communal dining and other activities which were designed to promote the health of individuals, such as excursions to the community, and so on. All of those became risk factors for COVID-19. The other major risk factor was the fact that many of the personal care workers in these settings are not paid very much, and they have more than one job in more than one long-term care. So when we got an outbreak in one long-term care institution, it became easy then for that to be shared with others. So the report, which I'll show you in a little while, has dealt in depth with long-term care and has provided recommendations to help decision makers. There are currently about 4 provinces in Canada that have launched public inquiries into how COVID has been dealt with in long-term care institutions. You can just glance at the other topics that are ongoing, and the slide set, as you know, will be available to you. The second one is on mental health. I wanted to just say a brief word about representations of science in literature, not only scientific literature, but even more importantly in terms of its impact is the effect in the social media. Dr. Tim Caulfield, who is a health lawyer and a member of the Royal Society, has had a long-standing interest in misrepresentation of science in social media, and he is chairing a group for us on that. The only other one I'll comment on is homelessness. Almost every country has individuals who, by necessity or by choice, are homeless, and it's really important for us to deal with that, especially in second waves. So we have a group that's working very hard on this. So this is the link for the Royal Society where you can obtain these documents. All of the documents that we've currently finished are online. And I will just, for a moment before I turn to the long-term care, and I've got this slide out of order, wanted to indicate in long-term care, it was not only the residents who were infected, but also the healthcare workers. So this is data from Nova Scotia, and there were 184 healthcare workers or volunteers with direct patient contact infected to date, and most of those have been in long-term care. This is the cover page of the long-term care report, and I do hope you will have a chance to download that and have a look at it. We have 9 recommendations regarding long-term care, and I won't go through those, but as you're thinking about recommendations, a large number of recommendations often defeats the purpose. So being very careful as to the recommendations that one is going to put forward to make sure they're the key ones is very important. These are the short-term topics, and again, you can download these because I'm conscious I'm running out of time. I would like to close with 3 comments. As you have done today by putting this important symposium on, there is definitely a role for national academies and scientific societies to help the world recover from COVID-19. And as mentioned, the conference today is one just such example, and the Royal Society response to COVID-19 is another such example. I want to thank you for inviting me to present on behalf of the Royal Society of Canada and all the colleagues that I have, now numbering 150 who are involved in working on COVID-19. So I look forward to the rest of the conference and especially to the discussion. Thank you.